Welcome to A Better Way. I'm Dr. Anthony Deutscher, and thank you for dropping by my website. Now, A Better Way, what is this all about? Well, it's like this. I designed this website and I base my practice around helping people that haven't been helped in other ways and in other places. Now, I'm sure you've seen some representation of this picture beside me before. Now, what you might not understand is this picture explains how a body, your body, is supposed to be working, and it gives you some insight as to why it might not be working. You see, this is a picture of your nervous system. Now, in a healthy body, the way it works is every single organ, well, even in an unhealthy body, all of the organs, all of the cells, every tissue, which means muscle, tissues that do immune system work, tissues that do hormones, tissues that do digestion, all those things, they rely on a life energy that is manufactured by the brain. Now that brain energy, it has to get to the organs and the cells and all of the tissues to keep you healthy and alive, okay? Now that tissue gets that life energy primarily from a connection to the brain through the spinal cord, okay? Spinal cord. Now the spinal cord is, in my opinion, the most important organ in your body. Now here's why. I know when you hear organ importance, most people jump right away to heart or brain. I'm not going to argue they're very important. However, if you consider how the body functions, okay, if you have a heart and if you have a brain, but no way to connect them, what do you have? You have flesh. You don't have life. So the connection between those things is vital, and that's the spinal cord. Now the way it works is this. This system, this nervous system, it works perfectly to keep your body healthy and strong if, and a big if, your spine is healthy. Now when I say your spine is healthy, I'm not just talking your back hurts or doesn't hurt, or your neck hurts or doesn't hurt. I've seen people come into my office who thought they were perfectly fine, and when we examined their posture, we examined their spines with x-ray, we saw devastation with no pain whatsoever. However, what I am talking about is alignment, and I'm talking about function. So the way it works is this. There's a direct relationship between your level of health and energy and the health and function of your spine. It's proven fact. It's not my opinion. I've seen it proven over and over again in my patients. You can check my Google reviews. I've got more Google reviews than any other doctor in the country. I have great results with my clients because I understand this principle, and I am the only structural corrective chiropractor in the country. No one else is qualified to do what I do. No one understands spinal structure like I do. Now, how does it work? Okay, your spine is supposed to have a particular alignment. Now, a healthy spine, pretty straightforward. It's straight when you look at it from the front. So from the top down to the bottom, it's got to be one vertical line, and it has to line up with your pelvis. I see so many people suffering from chronic back pain. When we look at their spinal x-rays, we look at their posture, their whole upper body is shifted to one side, and that's putting stress, as you can imagine, down here. So if you're one of those people, you're suffering, and maybe it's okay for a while, but once, twice a year it goes out, and it's like you can barely move, hard to tie your shoes, hard to dress yourself. This is probably why. And you've probably gone to other doctors, physical therapists, maybe other chiropractors, and it gets better temporarily, but it never goes away because they're not addressing this. And you can't find this out without having proper views. So that's the front view. It has to be nice and straight, okay? Now, from the side, your spine needs 3 curves. By far the most important is the curve in the neck. Most of the automatic stuff that happens in your body through this autonomic nervous system is controlled by the nerves in the top region of the neck, sort of between the base of the skull and down to about the lower middle part of the neck. So if that is not properly aligned with that nice C-shaped curve, and if Atlas isn't properly aligned, your nervous system is going to struggle to keep you healthy. That's where I come in. My job as a corrective chiropractor is to see how does your spine look compared to normal, and then apply that knowledge to what symptoms you're coming in with, what diseases you're coming in with, what pains you're coming in with. And when we make that correlation and we make a plan to fix it, we get phenomenal results because we're getting not to the symptoms, we're getting to the cause of the symptoms. Does that make sense? Now, here's how it works. If you're one of those people where you feel like you've tried everything else, you've been told there's no hope, or you're just sick of taking medication for every little thing, here's how it goes. In my office, we do a very, very simple exam. I'm looking for one thing. I'm looking for, is your spine in proper position and proper movement? Yes or no? If it's not in proper position, it's not in proper movement, I have special testing that I do to show me whether or not you can be helped. If we see that yes, you can be helped, then I know for certain that whatever's bothering you, we can fix it. We can return your body to normal function. Now, what this isn't a whole bunch of useless blood tests. This isn't a whole bunch of useless tests that are going to eat up time and money and all come up as they seem normal. But yet, although they seem normal, you're still not as well as you want to be. You don't have the energy. You're living with pain, and you're thinking there's nothing you can be that can be done. Or if they've never been able to really give you an accurate diagnosis, this is for you. This is where you need to be. This is not a bunch of waiting around. It's not a bunch of waiting for tests or waiting for months and months for MRIs. It's really simple in my office. I'm located at Stigtitsa 34. I have a parking lot, so when you pull up, you can just park right in front of my office. You can come right in. We do your examination. My examination with you will probably take us about 10 to 15 minutes, so it's not waiting for hours and hours and hours. Like I said, it's simple, it's direct. And then once we figured out what's going on with you by talking a little bit and looking at your body structure in the mirror and taking some pictures of you, we know what's going on basically. And then I send you for x-rays, a Röntgen Slika of your whole spine. And that's done right beside me. I'm at Stigtitsa number 34. The place that takes my x-rays for me, Stigtitsa 32, Polyclinic Bates. Perfect arrangement. You just park your car, you don't have to go anywhere, travel anywhere, you don't have to wait for an uplatnic, you don't wait in line, you just get the piece of paper from me, you go for the pictures that I need, and with that we can make an analysis and show you in black and white. This is where your problem is, and this is what we can do to fix it. If that sounds good to you, I'm so happy. I'm looking forward to hearing from you, looking forward to giving me a call. Just call the office 01-550-9544. Tell me that you saw this video, and we'll arrange something special for you to come in as soon as possible so we can get you checked and get you on a better way. So many people that I've met that have come through my office have told me that they've been trying and seeking for help for things, and they finally found help through a better way. It's not what you would expect. It's fast, it's simple, the results are extraordinary, and they're life-changing. Really sincerely looking forward to hearing from you and meeting you. I'm Dr. Anthony Deutscher of A Better Way.